Now to answer some common health questions, and joining us with all the answers is News Channel 5's medical specialist, Dr. David Soria. He is the chief of emergency medicine at Wellington Regional Medical Center when he's not stopping by our studios. So today we've got all summer, all the time. A couple of summer-related questions for you.
Yeah.
Nice to see you.
Good to see you.
Our first one, jellyfish stings. Are they dangerous? How dangerous are they?
Yeah, you know, it's like any other allergic type reaction. They can be very dangerous, and jellyfish stings have been known to be deadly at times. Typically, that's not the case. Usually, you just get a mild rash, but it can be anywhere from mild rash to a deadly allergic reaction. Bottom line, it's the tentacles that are below the surface that have the nematocysts, which are the stingers. So when you see the body, obviously stay away, because the stingers or the tentacles can extend a little bit farther. However, when you get stung, the key is...
A lot of crazy theories on this.
You know, there are a lot of crazy theories, and we're going to go into a couple of them. But the key is immediate treatment, because that's what can essentially get rid of the nematocysts and minimize the amount of rash. So what you do is hot water. Immerse wherever you were stung in hot water, and that will inactivate the nematocysts. Now, vinegar works pretty good as well, but some of the theories that you've heard don't work. For example, all right, urine.
Right.
Urine is not going to be helpful.
Doesn't work.
Save the drama. It's not going to help. Okay. All right. And then after that, essentially, all you need to do is a little Benadryl, some calamine lotion, and topical steroids, and typically goes away in a few days.
Very good. I'm glad we've cleared that up once and for all. All right, another issue youngsters and their parents deal with, typically at this time of year, poison ivy. What's the best way to treat that? Yeah,
poison ivy is not as serious, or certainly doesn't have the serious complications. However, it is one of the itchiest rashes you will ever have. Severe. And the other thing is it's stubborn. Lingers for about 2 to 3 weeks. Treatment's a little bit different. Instead of hot water, which you do not want to use for poison ivy, because what that does is it opens the pores and causes more absorption of the urushiol, which is the oil in the leaf. So you want to rinse thoroughly for about 30 minutes with cold water. After that, you could use some baking soda mixed with water as a paste, or if it's more diffuse, you sit in a bathtub, soak, and then after that, the treatment is the same. Benadryl, a little calamine, some hydrocortisone. The good thing about summer rashes is if you have those things in your medicine cabinet, for the most part, you can treat pretty much any allergy.
All right. Good old-fashioned baking soda. I mean, what doesn't that cure? Very good. All right. Hot for the jellyfish, cold for the poison ivy.
You got it.
Got it. Thank you, Dr. Soria.
You're very welcome.
And if you have a question for the good doctor, you can send it in by going to our website, WPTV.com. When you get there, just click that health link. Scroll down a bit, and on the right-hand side, you'll see a form to send us your question. Stay with us. We're